Hello, this is Dr. Catherine Kirby, and I'm back for part 2, and who knows, we could end up with 100 parts to talk to you about fibromyalgia. I do have pets in the house, so you may see or hear a cat or a dog or whatever. It's so much to talk about. I want to start where I left off, though. So back when I was worried about my own health and I seemed to be getting all kinds of problems, so I left off where I went to the doctors. And so, I told her my problems. I have this pain between my shoulder blades. I hurt, this hurts, that hurts. I'm tired, blah, blah, blah. So she kind of goes over my body head to toe, kind of like a physical, but I was dressed. And then she left the room, and that was it. I was checked out, paid my money, and that was it. Nothing was ever said. So one Saturday morning, it just came to me, fibromyalgia. Of course, I heard some talks about fibromyalgia when I was in training. I followed a rheumatologist around, and I do remember he had a lot of patients with fibromyalgia. I'm here by the window, and I noticed that my other podcast, when the sun comes out from behind the clouds, it lights up and then it gets dark. But this is the best lighting that I could find this morning. And so I got out of bed and started looking up things, and man, it all fit. And for me, I was relieved that I had one thing, not 20 things, because I was starting to feel like a hypochondriac. And I think that's why people get quiet. There were some patients that I had them for 10 years and then figured out they had fibromyalgia. And I said, how am I just figuring this out about you now? And they're like, well, I've just learned to, just deal with it, my aches and pains. I had a support group at one time, and people said over the years, they explained away every single symptom. Like, well, reflux, but I'm overweight. Well, I've been getting headaches. Maybe it's my eyes. I'm having trouble with this. I'm probably going through menopause, or maybe it's early menopause. Because fibromyalgia affects your entire body. So some clues that I would have is looking over multiple visits and seeing things like frequent urination, headaches, rash, fatigue. But I can tell you that I got really quick at spotting children with fibromyalgia, because normal kids would be sitting in the office looking around, what's this, what's that, can I have that? Kids with fibro were always laying down when I got in the room. So there's a chronic fatigue that they don't realize that other children don't have. Now my little grandson Tobin, he comes over and he'll say, Grandma, my legs really hurt. Or, oh, one day he just all of a sudden fell forward on the couch and said, my legs just fainted. Or he'll say, my neck hurts, Grandma. Can you heat up your pad for me? And I felt bad for him. He's 5 years old. And one morning they spent the night, and his brother, who's 8, bounces out of bed and starts jogging in place. And Tobin says, Nolan, I just woke up and my legs hurt. So kids have fibromyalgia. There's things that they know go together with babies with fibro, that there's a lot. I remember the lady I was telling you about, Shirley, who went for the neuropsych evaluation, and the doctor invalidated her, told me when she was a child, they took her to the springs, the hot mineral springs, because she had pain in her legs all the time. And these parents were told their kids had growing pains. Now, this is about as ridiculous as when doctors used to tell mothers that your baby's smiling because they have gas. I mean, that's about how ridiculous that is. growing doesn't hurt. So back to fibromyalgia. A lot of times people are undiagnosed. A lot of men are undiagnosed because men just think, well, I worked hard, I'm tired, it's probably arthritis. So here was a scenario. I had a patient that came in, she was like 30 some, and just this fatigue and aches and pains and neck strain and so forth. And at work, they tried to help her, they got her an ergonomic chair and so forth. But when people reach out to help you, they're frustrated when you're not reporting good results. Oh, so your neck still hurts, your back still hurts. And then you get sent to doctors. And I diagnosed a lot of people with fibromyalgia because it happened to me and my radar was up, my antennas were up. Warning signs were somebody that really winced when you blew up the blood pressure cuff, because when you have fibromyalgia, that hurts. And I'll get into other symptoms, but I want to get back to this young woman. So yes, of course I would run blood work and make sure it wasn't something else. But with fibromyalgia, the body is tender. You push and ouch. Ouch, ouch, oh, and then for hours afterwards, your body hurts. Or you go for a massage thinking it will feel well, and wow, later you hurt so bad, and you're thinking, I thought that was supposed to feel good. So when I told this young woman that she had fibromyalgia, her mother was with her, and I said, well, who has the fatigue and the aches and pains? And she and her mother both immediately said, Dad. Well, her dad was my patient, and he had had a knee replacement. He was getting near retirement. So the next time he came in for a visit, I said, hey, you never told me about aches and pains. He said, it's just everyday life stuff. So you learn to invalidate yourself, thinking, hey, nobody wants to hear this. And all of these patients are okay with me telling their stories. Maybe about a year later, this gentleman came in and he was getting sharp pains just flying into his legs. We call that lancinating pain. He described it like lightning flying in. And when I looked at his name, I realized, hey, that was his brother, the man I talked about before this. So I started asking him fibromyalgia type questions. And when you do that, at first someone is kind of like, yeah, and then they become suspicious, like, how do you know all this stuff about me? So questions I would ask are, do you wake up feeling really tired? Or if you do wake up with energy after you get going around 10 o'clock or so, does all that energy just kind of go away and you feel like crawling back into bed? On the weekends, if you get out of your schedule and you sleep in and get extra sleep, do you actually feel worse instead of feeling refreshed? In other words, do you have non-refreshing sleep? You're not refreshed. Do you get stiff after sitting? Do you feel worse after exercise? Instead of being energized, you feel tired. Do you get goosebumps? And this goes back to childhood. Do you sometimes get headaches? Now, when I would give people these questionnaires with all these little check boxes about 50 things, I would say, now I'm not talking about every day, but sometimes do you have these things? Cramps, and cramps that fly in and are painful. Dry eyes or sensitive eyes. You go to the dentist and you're looking in that light and your eyes can actually hurt. I've had people tell me, Dr. Kirby, now I even think my eyelashes hurt. Muscle fatigue, even just combing your hair. delayed fatigue. So you do something like rake the leaves, and man, the next day you can hardly lift your arms. Fatigue out of proportion for the task you did. Hey, I just went out there and pulled a few weeds, and now, man, I'm really hurting. Shortness of breath if you walk up a hill. And I'll just interject here, this is not your lungs. These are your muscles in between your ribs that fatigue. That story I told about walking up the lighthouse, that's what it is. Do you get irritable bowel type symptoms? Rashes, dry skin, rough skin? Do you feel like you're old? Because a lot of people with fibromyalgia will say, I feel like an old lady. Sometimes people come in and they're diagnosed because they think they'll start an exercise program, or they'll take a dance class, and maybe they get out of breath, or they feel winded, or their heart is pounding. Do you tend to be sensitive to medications? As a child, did you hurt? Do you get cold sensitivity? So you go outside and you get cold fast. You mind the heat. You get sweaty. And not only that, your sweat is irritating. You can't wait to get a shower because that sweat is icky. You attract insects. At the picnic, you're the one getting bit up. Back to being cold, I had a young woman who came into me 2 to 3 times a year for just medication refills, and she had chronic neck pain, and I never thought fibromyalgia until we got to talking about the cold affecting her. And when somebody tells you extreme measures, you think fibromyalgia. She opted to get a little heater at work. She had plug-in like pads for around her neck, her shoulders, her legs. Not only that, when she went out to drive in the cooler months, she would take all of this stuff out with her. Extreme measures. Pain with sex, feeling uncomfortable, both men and women, feeling sore on the inside, frequent urination to the point that sometimes you think you have diabetes, and then other days hardly peeing at all, irritable bowel, diarrhea, then constipation, stomach bloating. People with fibromyalgia gain fluid as the day goes on. So if you go clothes shopping in the evening, later you wonder why those clothes are too big. Like, what happened? You'll get sock lines, and even little kids with fibromyalgia get these. They can't wait to take off their clothes as much as possible. Take off their socks. Their shoes hurt. Your jeans or your pants leave a big crease around your waist as the day goes on. Your face gets puffy, and on and on and on. Dental tartar and buildup, and gingivitis, and so forth. So, I mean, reflux. You can see why after a while people feel like, am I a nutcase? I had a gentleman came in one day, and he was a very workaholic, didn't want to, oh, here's my big dog Hartley, didn't want to take time out to go to the doctors. And when I tried to talk to him about fibromyalgia, he said, look, you know, I was sitting here waiting for you to come in the room, and my head hurt. I thought, oh, I'm getting a headache. And about that time, my chest is hurting. And now that I'm sitting here, I have a cramp in my leg. Now, am I crazy? No, that's fibromyalgia. You can get knots where your muscles are all lumped up, and people describe muscle weakness. Now, when they look at normal muscles are organized like pencils in a box. They shorten and lengthen, they slide. People with fibromyalgia, their muscles look like spaghetti. They are so disorganized So when a massage therapist rubs that, ouch. But patients would say it's a feel good, don't stop it, that hurts kind of sensation. When someone rubs all those tight muscles, they're releasing the lactic acid that built up. And so after the massage, the day after, or all of a sudden you're hurting like crazy. All that, those muscles that are knotted build up lactic acid. Your muscles don't have the power that they should. So a few years back on a Friday